The title of today's training is Body Mechanics and Beyond. For years we have depended on correct body mechanics to prevent strain and sprain injuries. We learned that body mechanics are very important, and they certainly are, but they are not the whole answer to preventing injuries. In the next 40 minutes we will take our knowledge of body mechanics and go beyond to learn about ergonomics for healthcare. You've all heard of ergonomic tools or chairs, but what makes something ergonomic? Well, ergonomics is the science of matching workplace conditions and job demands to the people doing the job. So an ergonomic tool is one that matches the person using it. To find a good match in the workplace, we often need to find different equipment, redesign tools, change the way tasks are done, or reorganize the workspace, all to fit what the workers can do. Ergonomics studies work and how it impacts worker comfort, safety, and productivity. Ergonomics and body mechanics work together. We can think of it this way. Body mechanics tells us how to use our body safely, and ergonomics tells us how to fit the work and the tools to what our bodies can safely do. Let's take an example. We are lifting a heavy box from the floor. Body mechanics tells us to bend the knees, keep the load close, and do not twist. But sometimes the load is too heavy, even when using the best body mechanics. Ergonomic studies have determined a safe lifting limit depending on the location of the box. So by knowing ergonomics, we will know how much that box should weigh and where it should be stored in order to be lifted safely. We need ergonomics and body mechanics together in order to be safe. By ignoring body mechanics and ergonomics, we put ourselves at risk for injuries. Our goal today is to prevent injuries by learning about the musculoskeletal disorders that can occur. Who is at risk for getting them? What causes this type of injury? What are the risks in the jobs that we perform? And what are the symptoms and treatment for MSDs? We will also learn how to work in the safety zone to minimize risk and to identify work in the caution zone, meaning that there is a risk of injury present. Finally, we will look at common tasks and see if we can identify a better way to work. We'll use ergonomics to change the way we do the job, change the tools, or perhaps the environment. But first, we must understand how the body works. The head and trunk are supported by the spine. The spine is made up of 32 bones called vertebrae. These are stacked on one another, with the discs acting as shock absorbers between each vertebrae. The spinal cord, which is a huge bundle of nerves, runs down the center of the spine, surrounded by bone, and between each vertebrae, the spinal nerve branches off and travels to the rest of the body. Supporting the spine are many types of soft tissues, such as ligaments, muscles, and tendons. Ligaments are cords that attach bones and discs to each other. They can stretch, but not very much, so they help to hold the discs and bones in their proper place. Then there are 400 muscles that stabilize the spine, and close to 1,000 tendons that connect the muscles to the bones. You can see that the muscles of the back or the spine are thinner. They are designed for holding our posture. The thicker, stronger muscles of the legs on the right are designed for forceful movements, such as lifting. When used properly, the muscles of the spine move us into and hold us in good working posture, protecting the spine and soft tissues as we work. When the body is upright, as shown in the center photo, with ears over shoulders, over hips, over knees, over ankles, the vertebrae are aligned in the natural curves and there is minimal stress on the disc or soft tissues that we just discussed. By keeping good posture as we stand, sit, and work, we protect ourselves from injury. A good working posture is one in which the stress on those soft tissues is minimal. When we move further away from this good or neutral posture, such as when we bend over a bed or reach to the floor, the tissues become overstretched and the trouble begins. Overstretching can occur from staying in a poor posture for too long, or from being in a poor posture and then having to exert too much force. Overstretching can result in strains and sprains of those soft tissues, muscles, ligaments, tendons. We feel pain, and that pain is a warning sign to stop and return to a more neutral position or posture. Overstretching can also cause other problems. If you imagine the vertebrae being overstretched backwards or to the left in this picture, you can see how the joints in the back of the vertebrae, called facets, would get compressed. This can cause pain and inflammation, which can cause swelling and put pressure on the nerves as they lead through those little spaces. Now imagine the vertebrae being overstretched in the opposite direction, or forwards to the right in this picture. You can see how the pressure on the front of the disc would cause the gel in the disc to be pushed to the back. When this occurs over and over again, the outer border of the back of the disc gets weak, and in time allows the gel to bulge out or even rupture. Then the disc, shown in purple here, may press on the spinal nerves, which are in blue. The long nerve that runs down the back of the leg is called the sciatic nerve, and inflammation of this nerve is called sciatica. That nerve can be irritated for many reasons, one of which you see here is a herniated disc. One important fact, the discs do not have nerve endings. This means we will not feel pain if the disc is being damaged. We won't know the disc is weakening until it's bulging or pushing out on a nerve. Therefore, we should prevent disc damage now, before we're aware that it is happening. Musculoskeletal disorders, or MDSs, develop when one area of soft tissue is stressed over and over again. The soft tissues involved may include muscles, tendons, ligaments, joints, spinal discs, and nerves. This stress, if too much or for too long, can lead to strains, sprains, tendinitis, and bursitis. Some other common MSDs are carpal tunnel syndrome, trigger finger, herniated discs, rotator cuff syndrome, and sciatica. MSDs usually develop over time due to the cumulative effect of stress. Sometimes the tissues are weakened over time, but the injury occurs with one sudden movement, and this often hides the underlying cumulative cause of the injury. MSDs usually affect the back, neck, shoulders, and arms, including elbows, wrists, and hands. Less often, they may affect the legs. What are the signs and symptoms of MSDs? Well, when the soft tissues are being stressed, they have difficulty doing their job. So the first sign is often fatigue. If the demands on the body continue, fatigue progresses to discomfort and eventually pain. Joints may become stiff due to swelling. Muscles may begin to ache or cramp. Other signs may be numbness, tingling, or a burning sensation. Eventually, you may notice some reduced strength, for example, having difficulty opening a jar. These symptoms may come and go as you take rest from the activity, but if warning signs continue for more than 2 days, they should be reported, and if they are from a work activity, they should be reported as a work-related injury. Early treatment for MSDs is critical. The longer the symptoms continue, the harder they are to reverse. This is because the continuing stress on the soft tissues makes the inflammation worse. Tired, weak tissues are then more apt to be injured. Therefore, If not treated early, further and more severe injury can occur. If the symptoms continue long enough, permanent damage or weakness can result. The first part of treatment is to stop doing the motions that aggravate the stressed body part. So you would reduce the force, frequency, or the awkward position that was being used to perform the activity. Remember, there are activities outside of work that could affect the problem area. For instance, if your elbow is involved, playing tennis, playing the guitar, surfing the net, or cleaning the house can all add to the problem. So any doctor's restrictions should be used 24/7. Your doctor may prescribe medications, ice or heat, and possibly injections to reduce the pain and inflammation. Once those are under control, you may also be prescribed therapy or an exercise program of stretching and strengthening, and that's to return the muscle to a strong condition so it will be resistant to further injury. Whether you develop a musculoskeletal disorder depends on many factors. You are less likely to develop a problem if the work and home activities you do are within your capability, if your muscles are strong and flexible enough to do the work or activities without straining, if you have safe work habits. This means that you use good body mechanics and work within your limits, and if the work environment or tools fit you, allowing you to work in good positions and with your limits. The three biggest causes of musculoskeletal disorders are activities that involve awkward or prolonged postures. These are positions that place stress on the body. Second, using excessive force to lift, push, pull, or carry. This is the amount of physical effort needed to do the job. And thirdly, repetitive motion. That is, performing the same motion or series of motions continually or frequently. Posture is perhaps the most important because if you are doing a task in a poor position, you're starting out with stress on the soft tissues, just from the position alone. It will take a lesser amount of force and repetition to develop an injury. There are other risk factors for developing MSDs. One is cold. The tissues can be injured more easily when they are working in a cold environment. Vibration also makes tissues more vulnerable, such as in using hand or electric tools. Contact stress is defined as the repeated or continuous contact with a hard or sharp surface, such as your forearm against the edge of a desk that isn't rounded, or your finger against the handle of a tool. These can create pressure and inhibit nerve function and blood flow. There are also medical conditions that may have an impact and make an individual more prone to musculoskeletal disorders. Usually, there's more than one risk factor involved, and as time increases, the more the risk of injury. The greater the risk factors, meaning the more awkward or prolonged the posture, the greater the force, and the more repetition is involved, the greater the chance of injury. As these factors increase, the less comfortable and productive the worker becomes. So for safety, comfort, and productivity, we need to work in a way that we will call working in the safety zone. Based on ergonomic studies, the Washington State Department of Labor and Industries published a caution zone checklist. This checklist describes the posture, force, and repetition at which there's an increased risk of injury. The caution zone describes the point at which we should take a look and find a better way to do the task. As an employer, we want our employees to understand the risk of injury and how to work safely. More than a third of all employee incidents at 5-star are strains and sprains. In the last 18 months, 804 5-star employees had a musculoskeletal disorder. These injuries cost $5.5 million, or over half of the total cost of employee injuries for that time frame. These employee injuries are largely preventable if we work in the safety zone. So let's see if we can recognize work in the safety zone or caution zone. If we look at this employee doing this task, can you determine if he is working in the safety zone? Let's first look at body mechanics. His back probably just slightly twisted as he looks over the load, but basically straight and in a neutral position. His shoulders are back, his load is close, elbows are bent, and wrists are straight. But what is it that we really need to know if he's working safely? We need to know how much that box weighs. We also need to know if it's a load that's going to shift. Where did he pick the box up from, and where does he need to set it down? How heavy is too heavy, and how low is too low? That's where ergonomics comes in. Let's start by reviewing body mechanics, and then we'll look at ergonomics. We know that in order to protect the back, we should test the load by trying to move it with our foot or trying to pick up one corner. Plan the lift. Know where we're going and where we're going to set the load down. Be sure the path is clear. Get help if needed, either a cart or assistance of a coworker. Hold the load close. Keep the back straight. Tighten the core muscles. Bend the knees. Keep the shoulders back. Use the strong leg muscles. Keep your feet apart for good balance and base of support. Avoid twisting. Be sure that your feet and your shoulders are facing the same way. Use a smooth motion. Don't jerk to get the lift started. And be sure to coordinate the lift with coworkers. Body positions to protect the arms and hands may be less familiar to you. In order to stay in a neutral position with less stress on the soft tissues, we need to keep the elbows into the side. Avoid elbows that are raised higher than shoulders, and work with knees and elbows at least slightly bent. When elbows and knees are fully extended, they are more likely to be injured. Also need to work with wrists straight, level with the forearm, not bent or extended down or turned to one side. Also, it's better to use a full grip rather than a pinch grip. To protect legs and knees, we need to avoid squatting and kneeling for long periods of time. We are often asked about back belts. 5-star does not encourage the use of back belts because they have not been proven to reduce your risk of injury. NIOSH, or the National Institute of Occupational Safety and Health, has advised there is no conclusive evidence to support their benefits. Let's look at ergonomics now and what those safe lifting limits are. What tasks put us in the caution zone? Remember, if a task is in the caution zone, we need to think about a better way to do the job. NIOSH originally stated that the maximum lifting limit was 51 pounds. Now this, however, was determined using ideal conditions, meaning that the object had very good handles on it, it was held close to the body and at waist height, and it was only lifted once. But this is often not the case in the workplace, and especially not in healthcare. So a revised lifting limit was issued. This lifting limit is 35 pounds. So If you are lifting more than 35 pounds and cannot keep it close at waist height, then you are working in a caution zone. Other limits or caution zone criteria are bending forward more than 30 degrees, unsupported, repetitively, or for more than 2 hours total per day. Also, if you are bending forward more than 45 degrees without support for more than 1 hour total, you are in the caution zone. Squatting or kneeling repetitively or for more than 2 hours per day puts you in the caution zone. Other actions in the caution zone are working with hands above the head or elbows above the shoulders, either repetitively or for greater than 2 hours total per day. Keyboarding for prolonged time, meaning 4 hours a day, with awkward postures puts you in the caution zone. Also, keyboarding for greater than 7 hours a day, even if you have good working position, puts you in the caution zone. For tasks that require gripping or grasping, if you are pinching an object weighing 2 pounds or more repetitively or with awkward position, you are in the caution zone. Lifting 2 pounds is comparable to pinching a half of a ream of paper, to give you an idea of what that would feel like. And gripping an object weighing more than 10 pounds per hand, repetitively or with a hand cocked to either side or bent, is the caution zone. And that's comparable to using the jumper cables and clamping them onto a battery. That compressive force is what it would feel like to lift 10 pounds with a full grip. And to the side of this slide, you can see the wrist positions. And the ideal position is not shown here, and that is with the hand straight across from the forearm. Here you see it flexed, extended, and then bent to the side. So we've heard what the caution zone is. Let's see if we can recognize it in work tasks. Let's look at our maintenance workers. If they are painting and changing light bulbs, which of the big 3 risk factors come into play? I think right away from this diagram you can see that posture of keeping the hand and elbow higher than the shoulder comes into play and is a risk factor. In addition, repetition of moving that arm back and forth. Working on beds, I think right away we think of posture. There are oftentimes the employee crawls under the bed to work on them, or maybe working on knees or squatting. So posture puts them at risk. Lifting boxes or moving furniture, we generally think of the force involved. But again, we also want to think of posture. How can we make the posture in the safe zone? And then we would be able to move slightly more force. So good body posture is very important there. Removing trash. This is interesting because it often depends on the height of the individual as to whether they are in the safety zone for posture. The height and opening for your dumpster should be looked at in relation to the height of the employee. Also, the force involved would depend on the weight of the trash bag. So one intervention is certainly to control the weight of those trash bags. Pushing carts. Again, where are the handles? Can the employee maintain a good posture? And what's the weight of the cart? Is there excess friction because of the wheels being dirty or in poor condition? So that would impact the force. Using hand tools is very critical for the position of the wrist. And shoveling snow actually would involve several risk factors that we've mentioned: posture, force, repetition, and cold. So what can we do about these? One Quick fix is often the work posture. You can see in the first diagram the worker choosing to work on this object at a high table has his elbow far above his shoulder and puts him in the caution zone. By simply lowering the position of that object, he now has a good position of the shoulder, elbow, and wrist. Some ergonomic solutions might be to use a hydraulic lift to lift heavy objects and transport them from one place to another. More simply, we might be able to purchase the item in a smaller size bag or store the bags on a higher surface. Regarding shoveling, we want to make sure the length of the shovel is appropriate for the height of the worker. We can avoid having this employee bend forward by giving him a longer handled shovel. The electric screwdriver not only reduces the force needed, but also puts the wrist in a straighter, more neutral position. This offers a pistol grip. Let's look at housekeeping and laundry. The task of loading washers and dryers certainly involves repetitive bending, twisting, possibly force, lifting heavy wet blankets and bedspreads, and they need to perhaps take those items one at a time out of the washer and dryer. Folding laundry involves prolonged standing. The worker should change positions frequently and perhaps take some steps to load the cart versus staying in one position. Cleaning tubs and toilets certainly involves posture and repetition. Dusting overhead can put the employee in an awkward position with the arm out to the side to reach high, flat objects. Pushing carts involves force and possible position problems. Vacuuming and mopping involves, again, that forward bending, possibly some twisting and repetition, and the force if there's too much resistance. Some ergonomic solutions might be a long-handled duster with an angled end. This allows overhead dusting and keeping your elbow into your side. Mop heads should be purchased to allow the lightest weight mop that will get the job done. This reduces the resistance and force needed to push the mop. Sometimes a band on the top of the mop is provided to allow the employee to scrub difficult floors and avoid bending over. A laundry cart that allows the bag to be drawn out the side avoids bending over or pulling the bag up above waist height. And spring-loaded bottoms for all deep laundry carts should be in place. This allows the load to rise as it lightens, and the worker therefore doesn't have to bend forward as far repetitively. In food service, bending over the dish sink to scrub a pot requires that awkward forward bending and repetitive motion. Scooping and ladling involve awkward hand motions and sometimes very significant repetition. Cooking in large pots would require a lot of force. Hopefully we are not lifting that pot, but rather ladling the liquid out. And again, we have employees who mop floors, involving repetition of shoulder, forward bending, and possibly some force. Solutions might be, regarding our hand tools, once again, the design of the tool makes the difference. For a dry food scoop, we'd want to see a scoop that allows, again, a pistol grip. For washing dishes in the sink, that forward bending, we can invert a basin in the deeper sink and allow them to work from the top of that basin. In the office, common tasks are filing and keyboarding, both of which involve possible awkward posture and certainly repetition. The solution in the office is often driven by position. You want to know that the proper placement and choice of equipment is correct. The back should be supported in a neutral position, feet on the floor or a foot support, elbows at the side, and forearms and wrists are level and straight. You want to make sure that you avoid pounding the keys and take stretch breaks, 20 seconds for every 20 minutes of work. Resident handling tasks, such as transfers, repositioning, and bathing, have long been recognized as putting employees at risk for injury. Not only are there the risks of unexpected resident movement or performance, but all these tasks may involve awkward postures, forces above the lifting limit, and are repeated many times a day. When we consider that a person's leg weighs about 16% of their body weight, we realize that scooping up both legs of a resident to assist them into bed is equivalent to lifting almost a third of their body weight. So for a 150-pound person, that would be 50 pounds. We need to look at changing work methods and equipment to bring these tasks into the safety zone. Resident lifts have greatly reduced the force and repetition required by caregivers for transfers. Other ways to decrease the risk include gait belts, which provide a safe grip for guiding the residents in transfers. If used correctly, a gait belt helps the caregiver to maintain a safer posture, keeping the load close, the back upright, and avoid twisting. This is especially important should the resident start to fall and need to be lowered to the floor. By using a pivot disc, shown here, the resident is turned smoothly with less effort, avoiding awkward postures. If this device might be helpful, a rehab referral for evaluation should be requested. The bed assist rail allows a resident to roll or lift his body weight, reducing the amount of force the caregiver must use. The device shown is a Jorns bed assist rail, which can only be used on a Jorns bed. There's also a Halo assistive device, and it can be used on other beds, but a Halo should never be placed on a Jorns bed due to entrapment risk. The stand assist chair provides the mechanical assistance to raise the resident to standing, once again reducing the force that's needed from the caregiver. So if you find the job to be done is outside the safety zone, or that it's causing you discomfort or pain, be sure to tell your supervisor. It's important that the employees and the supervisors come together and work together, perhaps even with the safety committee, to conduct an ergonomic assessment. An ergonomic assessment is a team approach to looking at the work, how it's done, and how the task could be done more safely to reduce those risk factors. The steps involved are similar to any other assessment or investigation. The 4 steps are to collect information about the task, the environment, the tools, perhaps the policies and the training, and then determine the root cause. What's the biggest factor contributing to the risk of injury? To generate an action plan, what will be done, and then to monitor and revise it. Oftentimes when doing this, we want to look at those big 3 risk factors and ask, is the force too large? Is the posture too awkward? Or is the repetition too great? Ergonomics takes teamwork, but we also need to take it personally. There's a lot that we can do to reduce our risk of injury, such as work with good body mechanics, work within your capabilities and as you were trained, following the correct procedures, report when tasks are difficult or in your caution zone, help with ergonomic solutions, improve your own fitness. It is up to an individual to choose to work safely. Thank you for your attention, and now your trainer may have some questions to test your knowledge.